Hello everyone, this is Rabia Nazir and I'm working with Wendy Sauls on our case study Stroke in Acute Care Setting. First, we have to know what is a stroke. A stroke is a form of cerebrovascular disease that affects the brain's arteries. Stroke occurs when an artery carrying oxygen and nutrient-rich blood to the brain becomes clogged or ruptures. Stroke is the fifth leading cause of death in the United States. Strokes strike suddenly, often without any warning. What are the effects of stroke? Stroke may affect almost every function of the body. It can affect physically, cognitively, and emotionally. Physically, a person can be paralyzed, weakness, loss of feeling, or lack of coordination affecting face, an arm, or a leg, or an entire side of the body with visual problems, trouble speaking or swallowing. Cognitively interfere with thinking, interactions with others, or interpretation of everyday events. Emotionally depressed and irritable, the person can be in distress. The case for our case study, the patient we choose is a son of second generation immigration. History: 67-year-old Albanian male, well appearing, well nourished, blood pressure 140s to 150s over 80s, hyperlipidemia. He quitted tobacco smoking 3 months ago, 1.5 packs a day, denies any alcohol or illicit drug use. History: patient was last known normal at roughly 6 a.m. on July 25, 2017. His daughter noticed that her father was sitting outside, confused, and was speaking in fragmented sentences. He was able to ambulate back into the house without any difficulty. Due to continuation of symptoms, he came to the ER on July 31st, 2017. The signs he presented with, he was awake but confused, diminished comprehension, repetition, naming, reading, able to follow simple commands with pantomime, unable to interpret written phrases, unable to perform cross midline commands. Non-contrast CT had revealed a complete infarct involving the left posterior aspect of his brain. Our diagnosis for this patient is impaired verbal communication related to impaired ability to articulate or speak words because of ineffective cerebral tissue perfusion. Now I'm going to go over the pathophysiology of a stroke. Stroke is a brain attack. It occurs when blood flow to an area of the brain is cut off. When this happens, brain cells are deprived of oxygen and begin to die. When brain cells die during a stroke, abilities controlled by that area of the brain, such as memory and muscle control, are lost. The effect of ischemia on astrocytes is widespread in that signaling amongst astrocytes as well as between astrocytes and neurons or microglial cells are lost. This is likely altered in addition to the potential for necrotic or apoptotic cellular death. How a person is affected by their stroke depends on where the stroke occurs in the brain and how much the brain is damaged. For example, someone who has a small stroke may only have minor problems such as temporary weakness of an arm or leg. People who have larger strokes may be permanently paralyzed on one side completely from the stroke or lose their ability to speak. Some people recover completely from their strokes, but more than 2/3 of the survivors will have some type of disability. The physician's orders for this patient A was aspirin 325 mg once a day, metoprolol 100 mg twice a day, amlodipine 5 mg once a day, labetalol 200 mg every 12 hours if systolic blood pressure is above 160, heparin injection once daily subcutaneously, IV TPA was not administered due to the time of onset. Treatment must begin soon after a stroke is diagnosed to ensure that no further damage to the brain cells occurred and to increase the chance of full recovery. Medical and surgical treatment varies depending on whether on where in the brain the stroke occurred and whether the stroke is ischemic or hemorrhagic. Thank you.